We are here with Dr. Brian Koff from Joe DiMaggio Children's Hospital. Doctor, how is individualized treatment a benefit for patients?
To use leukemia as an example, a child who's receiving chemotherapy for leukemia, we expect by the end of the month that once they've been diagnosed that they're in remission. But our ability to really detect how in remission they really are has really advanced. So we can see microscopic levels of disease. And if there's a tiny little bit that's hiding out there still, we know that that child needs to get a more intensified therapy. As opposed to those who it's gone away really quickly and there's absolutely no evidence of it around, they actually might not receive as much therapy as they had in the past. So both ends really benefit from this. Needing more when you need more, or perhaps not receiving the same amount and not being exposed to the same side effects if you've responded beneficially. So when we treat a child with cancer now, we don't have to take a one-size-fits-all approach. We are able to really individualize the therapies so that if a child comes in with leukemia, it's not just leukemia anymore, and it's not even just this type of leukemia, but it's how is this individual child's leukemia responding to chemotherapy, and do they need more, or maybe even do they need less? So we're able to utilize a lot of technology that really individualizes their therapy so that they really get exactly what they need.
Why has this approach proven to be more effective?
When we treat someone with chemotherapy, there's side effects. While we know we have to, we don't have much of a choice but to utilize these strong medicines, they come with side effects. So if we're able to take a patient who's not in need of the same degree of treatment and really tailor back a little bit, we are going to be able to, number one, maximize their chance of being cured, but focusing more and more on maximizing their quality of life for the rest of their life thereafter, so that they're not dealing with the side effects of chemotherapy and all the other treatments to the same degree for the rest of their life. Today, the most current numbers that I know are that 78% of children who are diagnosed with cancer are cured. That number surprises people every time I tell them. But if you utilize something like leukemia, and more specifically our most common type of leukemia that we see, when I was born, it was basically a universally fatal disease. And now, for the most common type of leukemia, the cure rate is, about 90%, maybe even a little bit better.